We're going to position for apiaxial sacrum, apiaxial coccyx, and lateral sacrum, lateral coccyx. For apiaxial sacrum, we're going to start with a 10 by 12 image receptor lengthwise. I have my marker on there. You can also use a 10 by 12 collimation. For the SID, want to have the patient comfortable for this position, so we're going to bend their knees and put a cushion under the knees for comfort. And shield male gonads or female femurs whenever possible. Now, before you start this procedure, you should ask the patient, obviously, to change. Ensure if it's a female that you've asked the proper questions about pregnancy, and if the patient can, you should ask them to empty their bladder. That allows us to see that sacrum coccyx a little better. So for the sacrum, we're going to use a 15-degree angle cephalic and drop our distance about 2 inches. We're going to center to the mid-sagittal plane, and we want to go 2 inches above the pubic symphysis. Now we cannot palpate for the pubic symphysis, but you can imagine where that will be. Make sure your shield is not in the way. Patient's not rotated, straight on their back, and we can ask the patient then to hold their breath. And then they can breathe. Normally, when a patient comes in for an x-ray of their sacrum, they're also getting a coccyx x-ray. You gotta make sure that's the case. So if that were the case for this patient, I would just go ahead and do my other apiaxial, which would be for the coccyx. And I would just wanna angle 10 degrees coda. Dropping my SID again about 1.5 inches. I just want to go up a little. And this time I'm going to bring in my collimation to 10 by 8. The coccyx is a smaller bone. And again, want to make sure the patient is nice and straight. My central ray is going to be at the mid-sagittal plane and about 2 inches superior from the pubis symphysis. I'm going to ask the patient to hold still, hold their breath, and breathe. I would then go ahead and remove that sponge from under their knees and ask my patient to turn onto their side for my lateral positions. If the patient is not able to, obviously you would assist them. Also want to put a sponge between the patient's knees. Have them flex their arms and knees for this position, this way. They're comfortable and they're not moving on you. And having that sponge between the knees also alleviates some of the discomfort on the patient's hips. I'm going to use an SID of 40 for the sacrum. Column 8, 10 by 12. Shield my patient, make sure they are in a true lateral. And then I'm going to palpate for the ASIS and go posteriorly 3.5 inches. And I'm going to place a lead shield behind the patient to absorb scatter. This gives you a nicer image, sharper image, because you've removed some of the scatter. Again, I have my marker, my shield, my patient. I'm going to go ahead and ask the patient to hold their breath. And then breathe. I will then move on to the lateral coccyx, which I'm going to decrease my collimation to 6 by 8. And then place my central ray 3.5 inches posterior from the ASIS and about 2 inches distal from there. And ask again the patient to hold their breath and breathe. And that should do it for sacrum coccyx.